Hi everybody, and welcome to another edition of Alaska Health and Fitness Magazine. I'm your host, Tim Baxter, and for the next half hour, we've got some very important information to share with you, especially if you or someone you know suffers with varicose veins. Dr. Ty Bell will be joining us in just a moment to tell us that it's easier than ever to rid your legs of those pesky veins. Coming up a little later in the program, you'll meet Alaska's sleep doctor, Dr. John Kralik. If you or your sleep partner snore or have other sleep issues, you'll learn how easy it is to find out what's wrong and get it corrected. So let's get started with a visit to the Jordan Creek Center in Juneau, the offices of Vein Specialists of Alaska. We caught up with Dr. Ty Bell recently, and he told us some of the symptoms that go along with varicose veins.
The first symptoms generally are heavy and tired sensations, and it tends to progress as the day progresses. And they may not make much of it until one day they start to realize that's not so normal. They can ache, throb, sting, burn, itch. Restless leg syndrome is very strongly correlated with venous disease. So it comes in wide varieties as to what they complain about, but I would say heavy and tired feelings is probably the most common, and achiness. Many patients think there aren't many options other than the old traditional stripping surgery, which is really passé. Stripping was replaced slowly in the early 2000s, and by around 2005, the consensus was among surgeons that stripping was an inferior procedure, and the new endovenous thermal techniques, which involve laser or radiofrequency, were better procedures.
So a lot of patients are not sure how they know that they have vein disease. It could be multiple things. It could be some restless leg syndrome. It could be swelling in the legs, progresses throughout the day. It could be itching of the legs. You're not sure, you feel like you can get it, but you can't. They could be painful. You could have the bulging veins.
Hi, I'm Dr. Ty Bell with Vein Specialist of Alaska, reminding you that if you have varicose veins, we can help.
About 6 or 7 years ago, I had a small scab that showed up on my leg, and I didn't know what it was from, but it wouldn't go away, and it was really painful. So I went to a series of doctors, and they told me, well, it could be this, it could be that, and then I finally went to a specialist, and they told me that it was a deep vein issue, that I had a venous stasis ulcer that had grown on my left lower leg, on my inner leg, and so I went and had an operation, kind of like the ones that they did here, but unfortunately didn't have the same results. I struggled for many years with a lot of pain because of this, going to wound care. I worked out of town for a while, so that was pretty difficult with the self-maintaining of it myself. And then through going to wound care again, they actually recommended this office and Dr. Bell and Dr. Smith. And I came in, and I've had 7 operations since then and some really good results. I'm really happy with them, actually. They did a really great job. So
your situation was a lot more involved than many.
Oh yeah. It's been a long time, man. This has been a huge road that I've been on, and I'm just glad to see that it finally seems like it's coming to an end.
And everyone was very professional, very friendly, just put you right at ease, and talk through the whole process and how it worked. So it was very comforting to know that everything was laid out. There was no surprises. Dr. Bell and his staff were very, like I said, they're very comforting. It feels like you're home here. And so during the procedure, Dr. Bell made it clear that if there's at any time, if you feel any uncomfortable, if you're uncomfortable, or if you feel any pain at all, let him know, and he will fix it right away. So you don't have to go through that when you're having the procedures done.
On procedure days, one of my jobs is helping the patients feel comfortable. When they come in and they're nervous or they're anxious, we try to make it comfortable for them. We can let them choose music, we talk to them, we talk about their favorite things, and just talk about what they did for the day to help them relax.
We're successful because we like to treat you like we want to be treated. And when you walk in, we want you to feel at home. It's a pretty light and casual atmosphere. I like to joke around with patients and staff, and I think they realize that we have fun, and we generally do. We like what we do. I joke that I do the same thing over and over again, but what makes it fun for me is meeting new people And, you know, they have the same vein problems, more or less. I mean, it varies patient to patient, but I'm seeing the same things over and over again every day. And that's comforting because I get very good at dealing with the same thing over and over again, but I also get to know them as a person, and my staff does as well. So when patients call, they usually can put a face to a name, and that's nice all the way around.
I will highly recommend Vein Specialists of Alaska to go to take care of your legs, your veins, the issues that you're having. I think Dr. Bell would do a great job for you.
For anyone who was experiencing anything like my kind of pain that I was feeling in my legs, I would recommend coming to see Dr. Bell at the Vein Specialists of Alaska.
I love my dad, and you will too. Call today.
Hi, I'm Shauna with Vein Specialists of Alaska, and I'm the practice manager. I get asked a lot what makes us unique to other practices, and I think that we treat our patients like family. So they come in as a patient, but they leave feeling like they're part of our VSA family. So a lot of patients are not sure how they know that they have vein disease. It could be multiple things. It could be some restless leg syndrome. It could be swelling in the legs, progresses throughout the day. It could be itching of the legs. You're not sure, you feel like you can get it, but you can't. They could be painful. You could have the bulging veins. Some people say they have quite a bit of aching. Most patients are not aware that varicose vein disease is something, so they don't really know until they either go to the doctor or they hear our ad or something to indicate, oh, well, I have those symptoms, so I should probably call and make an appointment. We have a lot of those patients, and it's really important that you do get checked out, because would you rather go and pay a lot of money to go get something done, surgery-wise, or would you rather pay to have a consult done to see if that's an issue before? A consult consists of coming in. We take your insurance, have you fill out some paperwork so we can get some background, maybe some family history, some symptoms that you may be having in your legs. We bring you in onto our consult room. We get some extra background that we may or may not have. We'll do some ultrasound on your leg. That way we can determine if what you're feeling in your legs is actually something caused by veins. And that's basically what our consult consists of. It's really easy. You're not getting, anything crazy done. It's simple, fast. Usually our consults are an hour long, sometimes less.
My symptoms before I came to vein specialists were I'd have throbbing and pain in my legs at night. I would get tremors or where your legs will quake, and restless leg syndrome, they call it. It was really a relief to get my legs done.
Hi, I'm Dr. Ty Bell with Vein Specialists of Alaska, reminding you that if you have varicose veins, we can help.
It's just a company that you work for that is down to earth. Like there's no drama, and everybody cares about everybody and what they're doing. From the time that we say good morning to each other till the end of the day, and we're like, we did good, great job. We have a really good team. All 4 offices, we have a really great team.
What do your patients tell you about Dr. Bell?
They tell me that they enjoy him because he's got a good personality. He's got wonderful bedside manner. That's probably his biggest trait that I've heard yet. And that each patient he talks to, he always brings something home to it. So whether he's got it inside him or their heart or whatever, he definitely connects to them personally.
It's been very pleasing. We've been able to start in Wasilla and expand from there. So Wasilla, Anchorage, Soldotna, and Juneau, where we are today. And it's very pleasing to help a lot of people and try to come to them so they don't have to travel quite so far to see us.
If someone was talking about their legs aching and, some of the symptoms that I had, I would say, you need to go get some laser work done on your legs, because you will feel so much better. And especially if you're awake all night, which makes you tired, then you're not good the next day. So just go get it done.
When they come back and they say that they can get back to doing the things that they love, it's a good feeling knowing that you helped them.
The first person they usually talk to is a lady named Tiffany. She fields most of the calls, and they will be told kind of what to expect. And that is basically they can bring their own shorts, or we supply shorts, and we put them in the shorts and we examine the legs, looking for the telltale signs of venous disease. Sometimes it's very obvious with bumpy, lumpy varicose veins. Other times it's not. They may have hardly any symptoms, but they will turn out to have venous disease in a large number of those cases. But we examine the legs. We take a history, which is more vein specific. We want to know their general medical condition and other problems, as it may affect what we need to do with them. But generally, even people with a lot of medical comorbid conditions, we call it, it doesn't prohibit us from doing what we need to do. But the ultrasound is the most time-consuming part of the visit, and that's really the critical step. The ultrasound, we stand a patient to do that, to really stress the venous system to make sure it's either working properly, or if it's not, to find out where the problems are. And we like the patients to watch. Most patients like to watch, and we explain as we go. And then, of course, after we finish the ultrasound, we like to sit with them, explain in detail, and make sure they understand. And if there's a procedure appropriate, again, it's usually these endovenous thermal ablations, where we heat up the inside of a diseased vein to get rid of it rather than taking it out. The old stripping method was that. And make sure they understand, answer their questions, and so when they show up, they're well informed and usually at ease for the procedure.
Before I came to the vein specialist, my legs were always tired. My ankles were swollen. I mean, you could definitely see it at the end of a long day. And then at night when I lay down to sleep, there was burning and itching in the right leg and left leg. I could never get comfortable or stretch enough.
Dr. Bell is wonderful. I always hug him.
I highly recommend Dr. Bell.
I would definitely recommend Dr. Bell and the Vein Specialists of Alaska.
Most people will comment, and it makes me feel good, that their experience with us was much more pleasing than going to the dentist. And that's always pleasant to hear. And generally, the people that do opt for medication, we can do one leg on one particular day. There are reasons for safety of the patient that we don't generally do two leg procedures in one day. But if they take an anxiety medicine the first day, they may come back the next day and say, you know what, I don't need it. It's not near what I thought it was going to be, not near as bad as I thought.
Actually, I was excited to get it over with, because I got tired of looking at those ugly veins on my legs. The procedure was quite comfortable. They sit you down in the room, they have you lay back. They look at your legs and determine what they're going to do. Dr. Bell asks you if you want to listen to some music, and he actually let me listen to my own music, which was cool.
Yeah, tell us about that. Tell us about your music.
Well, I make music as a hobby at home on the side, after work or on the weekends. And it's just something I've been doing for like 10 years. Make music about anything from my native heritage to, like Christian hip-hop, uplifting music like that. For anyone who was experiencing anything like my kind of pain that I was feeling in my legs, I would recommend coming to see Dr. Bell at the Vein Specialists of Alaska.
Very warm, caring people, and very thorough. And I was very impressed with what Dr. Bell did.
Dr. Bell was very nice. We got along, right away we connected. And he explained all the procedures to me.
Call my dad at Vein Specialists of Alaska.
We hope you're enjoying this edition of Alaska Health and Fitness Magazine. I'm your host, Tim Baxter, reminding you that if you miss any part of our program, you can catch it online anytime at alaskahealth.net. That's alaskahealth.net. We caught up recently with Dr. John Krellick. He is Alaska's sleep doctor. If someone you know snores, or you've been told that you snore, you need to listen up.
Tim, it all starts with snoring. And the typical story is the spouse complains about the snoring. And that leads to the patient being referred to me, usually by the spouse, sometimes by their primary care doctor. And once they come in, we're able to talk to them, diagnose them very quickly, Tim, with the new equipment that's available, and more importantly, to treat them very quickly to get their problems with snoring and sleep apnea treated in a timely fashion.
What are the symptoms people need to be aware of for sleep apnea?
Anytime a person has symptoms suggestive of sleep apnea, they have to be aware of these symptoms. Do they snore? Are they overweight? Are they obese? Do they have high blood pressure, diabetes? Do they wake up gasping for air, short of breath, or even a funny sensation in their throat that arouses them from sleep? I hear about these symptoms all the time, and frequently when we test them, we find that they have this serious medical condition called sleep apnea.
If you or your sleep partner is snoring like this, it's time to call Dr. John Kralik, Alaska's sleep doctor. Sleep testing is easy and can be done in the comfort of your own home. Call Dr. Kralik today. No matter where you are in Alaska, Dr. Kralik fixes snoring. Before Dr. Kralik, after Dr. Kralik.
I've met people a lot of times who say, I am tired, I snore horribly, I've got my wife complains about me cutting logs, doing all these. You need to get yourself checked. I mean, you just need to go do it because it's the quality of life. I mean, if I'm just so exhausted that I can't enjoy a movie, I can't see the whole thing because I fall asleep. If I am driving down the highway and I'm a danger to myself and others because I might just doze off at the wheel, those kind of things, it could just be solved by having a simple test done in the comfort of your own home. Get yourself checked out, get treated in a week. It's, what is there to lose?
Tim, this device has revolutionized the way we diagnose sleep apnea. It's tiny, it's simple. The patient takes it home, puts it on one night, brings it home the next day, and we diagnose a very important disease called sleep apnea. And it is so simple to use, my patients just rave about it. It used to be years ago that people could only get diagnosed, Tim, by going into a fancy, expensive sleep laboratory. And across Alaska, that was not always easy to do. Most of these sleep laboratories were in the major population centers, and we have patients in smaller towns and villages all across the state of Alaska that we can mail this out to patients. They apply it themselves overnight, do a one-night test, and we can make that critical diagnosis.
The home test that Dr. Kralik gave me was extremely easy. I mean, it was just putting one thing on your finger, and then it was putting the little electronic thing, just lay
little box.
Yeah, it was just a little box. You just laid on your chest, and you just went to sleep, and that was pretty much it. There was no wires to hook up to your head or your feet or anything else. I mean, it was extremely easy. You didn't really have to figure it out. It was pretty self-explanatory. So that was really all there was to it. And then you just went to sleep. You brought it in the next day, and then they got all the information on it, and that's when he realized that I was severe sleep apnea, and that really surprised me that I was to that point.
Snoring can be a sign of a medical condition called sleep apnea. Left untreated, this can lead to serious medical consequences. The good news, diagnosis can be performed in your own home, no matter where you are in Alaska. Call us now for more information or visit us at alaskasleepdoctor.com.
If you or your partner snores, remember Dr. Kralik fixes snoring.
Before I met and came for treatment to Dr. Kralik, my wife and I were having some difficulties in our relationship, and it had to do with me keeping her up at night with my snoring. And so it all started with snoring, and I didn't realize at that time how bad it was, but of course in this day and age, my wife took her iPhone that she always has handy, and she took a video of me and recorded the audio of my terrible snoring, And I was surprised when she, confronted me with that. And she said, "You don't think you snore, Dave, but I've got proof that you do." And so that was concerning to me. I put it off for probably about a year. I went a year and we got into a routine where I would wake up in the middle of the night and she'd be gone. And I'd find her sleeping on I'm going to get emotional now because
That's okay.
She'd be gone. She'd be down in the living room on the couch. And I started feeling bad about that because my wife was, we've only been married about 5 years. We both got married late in our lives, first marriage for both of us. I was 52 years old when I got married for the first time. I love my wife very much. She's very precious to me. And so it started to hurt me that she would feel the need to leave because of my snoring and keeping her up. It wasn't funny. It was hurtful.
It is so rewarding to see not only the patients, but the patients' spouses to really appreciate what treating sleep apnea and snoring can do, not only for their medical conditions, but also for their relationships.
How long till I knew that I had sleep apnea? It was one of those things where you'd go to bed, sleep 7, 8, 9 hours, wake up exhausted. I'd stop moving at any time, sit on the couch or at my desk for any length of time. If I stopped, I'd doze off. In fact, the time I knew I was really in trouble is that I was live on the air, went to a commercial break, dozed off, woke up after 2 minutes of dead air and realized we might have a problem. Go see Dr. Krellick.
Snoring can be a sign of a medical condition called sleep apnea. Left untreated, this can lead to serious medical consequences. The good news, diagnosis can be performed in your own home, no matter where you are in Alaska. Call us now for more information or visit us at alaskasleepdoctor.com.
If you or your partner snores, remember Dr. Krellick fixes snoring.
Dr. Krellick is very personable, very down to earth, and is very informative. He answered all my questions and continues to see me and follow up occasionally. So he wants to make sure that things are still going well.
I'm 59 years old, and I've been putting this off my whole life. And to come to the realization that you've got sleep apnea to the point where you're stopped breathing 64 times within 60 minutes. I mean, that's a wake-up call. Say, something's got to happen.
Hi, I'm Dr. John Krellick, Alaska Sleep Doctor, with a reminder that if you or your sleep partner snore, I'm ready to help.
If you or your sleep partner is snoring like this, it's time to call Dr. John Krellick, Alaska's sleep doctor. Sleep testing is easy and can be done in the comfort of your own home. Call Dr. Krellick today. No matter where you are in Alaska, Dr. Krellick fixes snoring. Before Dr. Krellick, after Dr. Krellick.
This is a pretty serious thing, and you should really get it taken care of. It can cause you a lot of problems, especially if you wait too long and you decide to work on it later in life. All the staff is so professional, friendly. They really make you feel at home. I've told many people about coming to Vein Specialists of Alaska, and I'm going to continue to tell people about the great job that they did for me. I would highly recommend the people, if they're having these issues, please come to see them. They're the best.
So a lot of patients are not sure how they know that they have vein disease. It could be multiple things. It could be some restless leg syndrome. It could be swelling in the legs, progresses throughout the day. It could be itching of the legs. You're not sure, you feel like you can get it, but you can't. They could be painful. You could have the bulging veins.
Hi, I'm Dr. Ty Bell with Vein Specialist of Alaska, reminding you that if you have varicose veins, we can help.
Snoring can be a sign of a medical condition called sleep apnea. Left untreated, this can lead to serious medical consequences. The good news, diagnosis can be performed in your own home, no matter where you are in Alaska. Call us now for more information or visit us at alaskasleepdoctor.com.
If you or your partner snores, remember Dr. Krellick fixes snoring.
For
somebody that's had problems with their legs for years and they want to get a procedure done or just come in and get an ultrasound just to kind of see if it's something that they need to follow through or not, I would suggest they come and see Dr. Bell here at Vein Specialists of Alaska.
If I were doing it over again and the procedure was suggested to me, I would go as quickly as I could to Dr. Bell and the vein specialist because they are good and they keep to their promises.
Before I came to the vein specialist, my legs were always tired. My ankles were swollen. I mean, you could definitely see it at the end of a long day. And then at night when I lay down to sleep, there was burning and itching in the right leg and left leg. I could never get comfortable or stretch enough.
Dr. Bell is wonderful. I always hug him.
I highly recommend Dr. Bell.
I would definitely recommend Dr. Bell and the Vein Specialists of Alaska.
If you suffer from varicose veins, we can help.
How long till I knew that I had sleep apnea? You know, it was one of those things where you'd go to bed, sleep 7, 8, 9 hours, wake up exhausted. I'd stop moving at any time, you know, sit on the couch or at my desk for any length of time. If I stopped, I'd doze off. In fact, the time I knew I was really in trouble is that I was live on the air, went to a commercial break, dozed off, woke up after 2 minutes of dead air and realized we might have a problem. Go see Dr. Kralik.
Before I met and came for treatment to Dr. Kralik, my wife and I were having some difficulties in our relationship, and it had to do with me keeping her up at night with my snoring. And so it all started with snoring, and I didn't realize at that time how bad it was. I was surprised when she, confronted me with that.
Call us now for more information or visit us at alaskasleepdoctor.com.
Very warm, caring people, and very thorough. And I was very impressed with what Dr. Bell did.
Dr. Bell was very nice. We got along, right away. We connected. And he explained all the procedures to me.
Call my dad at Vein Specialists of Alaska.
We do treat varicose veins here at Vein Specialist of Alaska, and the treatment has gotten much easier over time.
My varicose vein was sticking out, protruding, and I didn't want it to do that anymore. It's pretty simple, non-invasive, you're alert, oriented the whole time. It didn't hurt, you don't shed a tear, and your leg looks better.
Call my dad at Vein Specialists of Alaska.
Well, we hope you've enjoyed this edition of Alaska Health and Fitness Magazine. Our visit with Dr. John Kralik, Alaska's sleep doctor, and earlier in the program, Dr. Ty Bell with Vein Specialists of Alaska. If you'd like information about either of these practices, just get online to alaskahealth.net. That's alaskahealth.net. And if you're a healthcare provider and would like more information about being a part of a future program of ours, all you have to do is email us at the address on your screen. Send us an email. We'll be in touch. We'd love to hear from you. Thanks so much for joining us. We'll see you next time on another edition of Alaska Health and Fitness Magazine.